guys. So today we're going to talk a little bit about what we do at the Facial Plastic and Reconstructive Center. We've had a lot of patients come in and say, oh my gosh, I didn't realize that you guys did that. And so the way I like to think about it is basically from the collarbones up. So anything on the head, neck, or face, really excluding the actual eyeball itself, the brain, or the spine, we probably do either surgery or non-surgical procedures in this area. So we do both cosmetic as well as reconstructive. So some of the common surgeries people think about with plastic surgeons: facelifts, brow lifts, eyelid lifts, or blepharoplasty, rhinoplasty, chin implants, otoplasty, or pinning the ears back. If you rip your earlobe, or maybe you had a gauge in there and you don't like the way that looks anymore, we certainly do repairs on those type things. We do all the non-surgical stuff that many people are familiar with, like neuromodulators. Botox is the common one, but we also do Dysport and Xeomin. Facial fillers, you may have heard of Restylane or Juvederm. We also do Belotero, Radiesse, Voluma, Restylane Silk, Restylane Lift. We also do fat grafting or fat transfer, so almost everybody has like a little extra fat. You can actually use that. Usually in the operating room we'll put that into the face to restore volume. We do all the facial resurfacing, so things like lasers, microneedling, dermabrasion, chemical peels. We do all that type stuff. We do a lot of cheek enhancement, lip enhancement. If you can think of it, we probably do it. A lot of patients will come in and have a defect from a skin cancer that's been removed, and we'll move adjacent tissue from other parts of the face to help reconstruct that area. Facial trauma, so maybe someone got in a car accident or got in a little scuffle and broke their nose or another bone on their face. We'll often fix those for patients. Very often also, a patient will have a scar from some type of accident, and maybe that scar is in an unfavorable orientation, or it got too thick or keloided. So we'll often do repairs on those type things. We do some congenital deformities as well. We do head and neck cancer reconstruction. So if you can think about it, again, if it's anywhere from the collarbones up, non-surgical or surgical, both cosmetic and reconstructive, we probably get involved with that. Lately we've had a lot of patients come in with a facial nerve issue, so it looks like they've had a stroke on that side, but usually it's some type of peripheral nerve, like a Bell's palsy, or maybe they had a tumor, and so now these patients have difficulty with smiling, difficulty with closing their eye and keep it moisturized. We do all that type stuff. We do many of the newer technologies like platelet-rich plasma. We're doing that in combination with skin resurfacing. So again, if you have a specific problem, concern, deformity, please come in, have a consultation. We can talk to you about which different options exist, both surgical and non-surgical, to try to get you to where you'd like to be. So if you have any questions, just please let us know. Thanks so much.